Thank you, Dr. Duvivier. I first want to thank everybody for attending virtually today. These past weeks have been unimaginably challenging, heartbreaking, grueling. No doubt many of us could use a long vacation. So by taking a few hours out of your Saturday to join us truly moves me. Thank you for that gift. And whether you're joining us today to hear our amazing keynote speakers to further your learning in health equity for the CME opportunities, or to simply support the OMA, I'm glad you did. I am truly passionate about this organization, and I'm thrilled to take this opportunity to present this year's State of the OMA Address. One of my missed opportunities over these past 2 years was not being able to talk with you in person around the entire state about the amazing achievements of the Oregon Medical Association. COVID-19 had other plans. This year, the Oregon State Legislature held its 81st legislative session. And unlike any past session, it was held entirely virtual. This meant a lot of things looked different. No in-person lobby days. There were virtual committee hearings and testimonies and plenty of distraction, though maybe that's not so different. Even with these differences, OMA was able to hold its annual Day at the Capitol event virtually to promote key policies such as reducing administrative burdens, extending pay parity for telemedicine visits, and fighting for liability protection during the pandemic. Over 70 physicians, physician assistants, and students attended the virtual Day at the Capitol. Ultimately, OMA was successful in passing two key policies: telemedicine payment parity and utilization management. As many of us witnessed, telemedicine has become a key aspect of care delivery during this pandemic. In 2020 and into 2021, federal and state regulators ensured the providers were reimbursed for telemedicine visits in parity to office visits. OMA led a large coalition of provider organizations to ensure this payment parity remained after the pandemic, passing House Bill 2508 into law. A priority issue for several years now, OMA also led a coalition of provider and patient advocates to introduce House Bill 2517, addressing utilization management protocols such as step therapy and prior authorizations. And this legislation ensures that if commercial health plans employ such cost containment programs, they use a process that is transparent, efficient, and fair. These are big wins for OMA members and all healthcare providers across Oregon, for which your OMA team deserves much gratitude. Finally, as the pandemic began and new guidelines and executive orders started to affect standards of care, OMA began advocating for limited liability protections for healthcare providers. Ultimately, over 12 months of negotiation, narrowly tailored and reasonable protections for healthcare providers were created in the form of Senate Bill 780 for those following government-imposed COVID-19 rules and executive orders that impact care delivery. And despite the bill passing the Senate with bipartisan support, the bill ultimately was not allowed to move forward by House Democratic leadership. That said, it's important to note that this issue is far from over. As we experienced late this summer and early fall, ICU beds are full. Ventilators and other medical equipment is scarce. And we are all forced to make difficult decisions about potential delay in care. The OMA will continue to advocate for proper protections for healthcare providers who are in situations where standards of care must be modified. In the end, your OMA government relations team tracked 722 bills and budget items during the 109-day session. Again, much gratitude to this team and all they do and continue to do to advocate on our behalf. Whether you are an OMA member or not, all physicians and physician assistants in Oregon benefited from these efforts. So I urge all non-members in attendance today to become members. We need you. Even with the pandemic spreading into its second full year, some regular businesses resumed. Late last year, the OMA, along with the American Medical Association and the Provider Clinical Support System, unveiled a powerful tool for Oregon clinicians to begin reversing the overdose epidemic in the state. This toolkit contains data, critical state and national guidance for safer prescribing, information on Oregon's prescription drug monitoring program, resources for harm reduction and overdose prevention, as well as resources for substance use disorder treatment and recovery. The Oregon Health Authority and OMA's Steering Toward Health campaign also continued this year, launching a new online toolkit offering research-based, in-depth materials for providers and patients, encouraging lifestyle changes around physical activity and arthritis pain management. And though much of our time this year has been focused on overcoming COVID-19, these materials truly offer an easy and virtual tool to offer patients during the pandemic. In addition, OMA's Equity Task Force, which formed shortly before I became president in 2019, has been busy at work this year. In addition to its report and recommendations regarding equity and inclusion within the healthcare profession, this task force was asked to expand its scope to include systemic racism following events of 2020, including the murder of George Floyd. After a year of discussion and study, the Equity Task Force presented their final report and recommendations to the OMA's Board of Trustees this past June. And the report concludes that our healthcare delivery system is falling short. We cannot achieve optimal health results without addressing both disease and the various upstream determinants. OMA's Board of Trustees adopted the task force's recommendations that recognizes racism in its systemic, cultural, interpersonal, and other forms as a serious threat to public health, as well as a threat to the advancement of health equity and as a barrier to appropriate medical care. In addition, the OMA will transform the Equity Task Force into a standing Justice, Equity, Diversity, and Inclusion Committee, as well as collaborate with other organizations to promote health equity, inclusion, and diversity. These recommendations and actions do not mean our path toward health equity is over. Far from. More than ever, individuals are looking to the healthcare industry to address long-standing inequities, and OMA is poised to be part of the solution moving forward, embracing a renewed focus on health equity. Which brings us to one of our main purposes here today. But before I hand it over to Dr. Duvivier to outline today's agenda, I'd be remiss if I did not address our situation over the past nearly 2 years, a global pandemic from COVID-19. In recognition of these past 20 months, it's vital to recognize all the physicians, physician assistants, and those in the healthcare field who continue to steadfastly respond to the crisis faced professionally and as a community. And along the way, even as I was busy with my own patients, I was witness to the amazing work the Oregon Medical Association leadership and staff did to support physicians and physician assistants across the state, offering resources, weekly emails, guidance, and advocacy to healthcare professionals, regardless of membership status. When practices were shut down last year, OMA worked with the governor's office and the Oregon Health Authority to ensure they could reopen safely. And when there was a shortage of PPE and COVID-19 testing supplies, OMA worked to help practices acquire adequate supplies and ensure they were available for all clinics. When vaccines became available, OMA worked to make sure all providers, including those not affiliated with a hospital or health system, could gain access. And as we faced the worst surge of the pandemic due to the Delta variant this past summer, the OMA was part of all major statewide discussions to understand vaccine mandates and continue to advocate for liability protections as ICUs filled and hospital beds and equipment became scarce. When I addressed you last October, our neighbors were still banging pots and pans there every evening. We were classed as heroes among our communities. Individuals and families and businesses donated PPE to ensure our safety. We are not where we were a year ago. We've all experienced a shift in one way or another. It hasn't been easy. We ourselves are parents, caregivers, human beings. And 2 years ago at my president address, I discussed the role of trauma in people's lives. I had no idea then what we would all be facing just 7 months after that speech. There are stressors in our private lives that affect us just as much as those in our professional lives. And we will need to focus on what we all need for resiliency. I want to stress one thing. All of us have remained constant in our approach to caring for patients and communities and each other. And that makes you all truly heroic in my eyes and in the eyes of everyone here at the OMA. Your work is purposeful and it is important. Thank you. Please continue to take care of yourselves, your families, and each other. We will get through this. Thank you for the opportunity in being your president over the past 2 years, and sincere thanks to my friends and colleagues on the executive committee, the board of trustees, the entire general membership, and the most amazing and talented leadership and staff of our OMA. And with that, I'll hand it over to Dr. DeVivier.